It sounds to me like, from what I'm hearing more and more, that we should rest this reform of our system, not someone else's system, not some other country's system, but our American healthcare system.
I agree.
We should rest it on a few fundamental pillars. One is
Saying.
consumer choice.
True.
All of us as Americans who seek out health care should have a choice. You like who you have, you like your health insurance now, you should get to keep it. Maybe we'll even make it cheaper for you because we'll make it more efficient. No free riders. We should all share in this responsibility, and everyone should participate. You have some who say, no, I don't need to, I'm still young and healthy. You may get hit and all of a sudden by a car, and all of a sudden now you're our responsibility. So everyone should participate, no free riders. And of course, no lemons. None of us wants to find out that we're paying $5 for an aspirin tablet when we go to the hospital. And so no one should be asked to pay for anything less than quality health care. And so those seem to be three very fundamental pillars that we should all really seek to achieve when we talk about health care reform. And on the issue of choice, which also includes the issue of competition, we want to make it robust. So consumers are the ones should be the ones that choose who their doctor or provider is. It shouldn't be the other way around. And in that regard, I'd like to ask Mr. Pickering a question. You talk about this cost shifting and why we shouldn't have a public health insurance option. Most Americans would say, I want to have as many options as I can. I'll select. Don't tell me I can't have this option. Let me decide if I want that option or not. But it sounds like you're saying, no, let's not give folks that particular option. Do you believe that today we should eliminate Medicare?
No.
No. Now, that's a public health insurance plan that seniors get today. Some 48 million seniors rely on Medicare, and that's a public health insurance plan. Do you think the Veterans Health Care Services, through the Veterans Administration, that our men and women in uniform who are now veterans receive should be eliminated?
No.
Okay, and that's also a public health insurance plan, is it not?
Yes.
Okay, so you would want to tell veterans, you can choose. If there's a private health insurance plan out here, you can choose that, or you happen to have access to the Veterans Administration's hospitals and doctors, and you can choose that. But we leave it to the veterans to decide where they go, right? Correct. And to seniors, a senior can collect, use its money to buy a private health insurance policy today, or it can choose to use the Medicare program that's available to a senior today, some 48 million seniors. That's a choice they should get to make versus any of us, right?
Agreed.
Okay. So now, my question is, why is it okay for seniors to have all that choice? Why is it okay for veterans to have that choice, but not decide to allow all those Americans who we're trying to bring into the system so we can make it far more efficient and cost less, that they get to have that choice of deciding whether it's a private health insurance plan or some public health insurance plan that might be an option to them as well. Something similar to Medicare, and Medicare for middle-aged Americans. Why would you want to limit an American's choice to a Medicare-type health insurance plan?
It's not that I would want to limit the choice. It's that I fear that with the current payment structures of private plans versus a public plan at Medicare rates, that the payment plan or the private plans could not compete against those rates.
Because what you call the cost shift.
Well, can I draw one distinction? So it's interesting in the Medicare Advantage program, you have the government plan, traditional Medicare, competing against the managed care plans.
Yes.
Most of those managed care plans are able to contract at approximately 100% of Medicare with providers because providers will accept that for Medicare patients.
Right.
It's not the same situation on the commercial side right now in the country.
Actually, it's interesting that you would bring up the private for-profit health insurance plans that participate through the Medicare Advantage program within Medicare, because in a way you have a private plan within a public health insurance program, Medicare. And everything I've seen, it shows that those private for-profit health insurance plans within the Medicare system actually get reimbursed at higher rates than those doctors and hospitals that are going through traditional public health insurance plan options within Medicare. And so that would seem to me to actually show the cost shift going in the opposite direction of where you're saying is that you're saying that right now we're shifting costs from the public sector, the public health insurance plans, to the private plans, when in fact you have the Medicare Advantage program, which actually shifts the cost from taxpayers I'm sorry, from the Medicare private for-profit plans to the taxpayers. And also, if you take a look at, and I know Mr. Chairman, my time has expired, if I can make this last point. I should take you down to Los Angeles, where I live. In my county of Los Angeles, the county hospitals take care of any number of people. Only 8% of the people that come in through the doors of the county hospitals in Los Angeles are covered by private, for-profit health insurance plans in combination with Medicare. And so what I see, at least in Los Angeles, is that public health insurance plans and options are subsidizing private for-profit health insurance plans that are unwilling to offer plans to the poor or the sicker Americans. And as a result, the public hospitals and these public health insurance plans are having to take the burden of the fact that the private for-profit health insurance plans aren't yet willing to take all these millions of Americans. And so I'd actually say you should take a closer look at your study. It looks to me like the cost shift is occurring in the private for-profit health insurance plans, shifting costs onto the taxpayers who end up paying through these public hospitals or through programs, public health insurance programs like Medicare and Medicaid.